Evening guys, hope you're well. I was doing some role plays with someone today and we got onto the topic of talking about patients who refuse medical advice. For example, they refuse to stay in hospital when we think they should do, or they refuse to go into hospital when we think they should be admitted, or they refuse a medication, for example, that we think may benefit them. Of course, patients have the right to make decisions about their healthcare, but one of the things that we should be doing in that discussion is thinking about ultimate risk and making sure that patient understands the ultimate risk of them not taking that medical advice. For example, if we think someone needs to go into hospital or be admitted and they don't want to go in, we need to make sure they understand the ultimate risk of not going into hospital. So Mrs. X, when it comes to this condition, the reason we like to get people into hospital pretty quickly is that if we don't treat it quickly, potentially it can be a life-threatening condition. Now, potentially life-threatening makes them understand that the ultimate risk is pretty significant, and any decision that they make needs to take that into account. If, for example, we want to give someone a medication to reduce their risk of a stroke, if they don't want to take that medication, that's fine, but we need to make sure they understand the ultimate risk of not taking that medication. So Mrs. X, the reason we like to give patients this particular medication is that in your condition, the risk of stroke is slightly higher. So if we don't give you this medication, then potentially there could be a risk of having a stroke going forward. Now that's the ultimate risk. They need to understand that for it to be a valid, competent decision. So if you get a role play scenario where someone does refuse medical advice, make sure you've got to that ultimate risk point before you move on and start to think about how next can I help this person. Really important to bear that in mind. Much more like this across our CSA PLAB and Stage 3 courses, online training and audio training. #CanPassWillPass, #I went with Arora.